Good afternoon, colleagues. Goeiemiddag, Molweni. Dis dankbaar julle is hier so in die reën. Thank you for coming over here, even although the rain has started to fall. I must just start with an apology, two apologies, from Professor Ramjugannath and from Dr. van der Merwe. Unfortunately, due to some diary events, they couldn't make it. But they wish they could be here, and they really wanted to join and also listen to our guest speaker today. But yeah, we know that things happen. So on their behalf, I'm doing the welcome, just saying welcome here. Most of you, I think, know me. I think there's one person next to Adalian that I've not met before, but I'm Nicoline Herman from the Center for Teaching and Learning, and we arrange these quarterly seminars on behalf of the Division for Learning Teaching Enhancement, under the auspices of the Deputy Vice Chancellor, Prof. Ramjugannath. So here we always ask the fellows, the SU fellows, the TAL fellows, champions of teaching learning assessment at the university to come and share their knowledge and their experiences with us. Yes, sorry, Dani, there's always some chairs moving around over lunchtime. So, as the organisers, I'm just going to remind you of the attendance register. If you would please sign that, you know that we always have to do that. There will be a feedback form that will be distributed later, if you can also complete that, because we always use that to then enhance the offerings that we have for our lecturers. So, Karen will come up and she will introduce our speaker, and then the speaker will have roughly 25 to 30 minutes to do her presentation. And then we will have a Q&A, so please keep your questions for the end. Then we can interact with Marianne, and then it will be the closing and looking forward to the next session. So, all right, as I said, we're really fortunate to have these sessions under the auspices of the Office of the Deputy Vice Chancellor, and we're also then fortunate to have our champions who always present for us. So on this note, I'm going to hand over to Karen, who will introduce the speaker and the topic for the day. And I trust you actually all remember the speaker and the topic for the day, because that's why you signed up. So thank you, Karen. Over to you.
Thank you. Good evening. Thank you very much for coming, colleagues, and thank you, Nicoline, for setting us off today. I don't think I need to introduce myself, so I would feel highly embarrassed if I have to do that. But it is my privilege to introduce our speaker today, and it is really an honor to have you here. Professor Marianne Unger is from the Faculty of Medicine and Health Sciences and the Division of Physiotherapy, as you can see on the screen. She's a passionate lecturer in physiotherapy, offering 27 years of experience. She has served on and chaired various committees, including undergraduate program and research ethics committees. She has a PhD in pediatric neurology, with a special interest in better understanding movement strategies for improved interventions in children with cerebral palsy. Concerned about future physiotherapy practice and education, she furthered her training in teaching and learning and recently completed an SU teaching fellowship. She drives the program's curriculum renewal and is excited to discover new and innovative methodologies to improve students' experiences while preparing them for the changing scope of future physiotherapy practice. So welcome, Marianne, thank you very much. And you can see that she is going to talk about curriculum/program renewal, balancing clinical competence and critical skills development. We look forward to listening to you. Thank you.
Thank you. Thanks, Karen, for that awesome introduction. Curriculum/program renewal. Maybe just quickly explain that. And my fellowship actually started off with the intent to renew a singular program, a singular module. But due to circumstances at the time, I was sort of pushed into taking on the lead in renewing our entire physiotherapy program. And I know it's all about semantics. Curriculum is often referred just can be the curriculum of a singular module, but ultimately what my fellowship resulted in is also taking the lead and driving our programs renewal. Thanks, in the absence of Prof. Teresh and Antoinette, just once again to say really thank you. It's a really awesome opportunity, and really appreciate the face-to-face opportunity, because as many of us are slowly starting to experience, nothing beats the face-to-face interactions. So, I always like to begin with the take-home messages for fear of I'm a little bit boring. And the 4 key messages I would like to leave you with at the end of today's discussion is really that we need to start thinking about developing critical skills or graduate attributes as part of what it means to develop a professional. And it's not a separate, and we shouldn't be trying to find ways to add to what we are currently doing. And similar as with any other skill, the literature is quite explicit and helpful in describing the building blocks that are needed in order to develop these. I like to call them critical skills. We refer to them as graduate attributes. I've recently heard power skills. And that, therefore, we should be viewing it as part and parcel of developing this graduate that we hope to graduate, and that the building blocks for developing these actually start in day 1 of year 1, and that how we scaffold these building blocks throughout the curriculum is really the key. I also want to offer you an evidence-informed and a sustainable method how to balance critical skills development with ensuring clinical competence. And then my final take-home message, as I will share our experience in physiotherapy, is that one really must not underestimate that embarking on a program renewal is a mammoth change management process. It's more than just changing things on paper. So yes, wouldn't be appropriate for me to continue without actually acknowledging the team. And if it stresses you out to see so many names on the board, this is what it takes. And this is what I was referring to in terms of change management. These are the people that I have been communicating with since around about 2018. And it's by far not a complete list. But the team I'm particularly proud of is those names on the left. The ones in the middle are our admin support in our own Centre for Health Professions Education, and the rest of the colleagues there were colleagues that started with us but have since either retired or grabbed other opportunities. And those on the right are the colleagues from the rest of our faculty, but also from this faculty. Roughly 50% of our offering actually comes from service modules that support our physiotherapy program. So wrong button. So what I'm quickly going to share with you in this short 20-25 minutes is a background to understand our program, but also explain why we found it was necessary to embark on this mammoth task. Share with you a little bit the approach we took to guide our renewal. I'm not going to speak too much on the 4CID model. I've previously presented in Auckland where I advocated for this particular model to help us when we design our curriculum. I'm going to spend a little bit of time on talking about problem-based learning because it's not a methodology that's employed by many. And as I said at the end, some of our lessons learned. I have to share with you this quote. It is prominent in my office, and it's what inspires me every day to keep doing what we are doing. So in physiotherapy, we are quite fortunate, unlike many of our other provisional programs, in that we are guided by what it is that we need to teach. We have minimum standards set by our regulatory authority, which is the Health Professions Council, and more specifically the Board for Physiopodiatry and Biokinetics. We also have a very well-established world organization, World Physiotherapy. They have member organizations from all 5 continents, and the benefit of that is that many of these countries do publish information that is informative for us who are involved in training physiotherapists. The most recent publication, which is the most helpful when it comes to what it is that we're trying to do in the new curriculum, was published by the World Health Organization. It's a rehab competency framework. And what's really nice about that is just by nature of the words, it's not discipline specific. It talks to the complexity of rehabilitation. And what's really nice when one does engage with this kind of framework, it acknowledges that if we're going to deal with these grand challenges that we are faced with and want to produce people that are capable of making a difference, that multidisciplinarity needs to extend outside of our disciplines, or outside of, in our case, the field of rehabilitation. And that framework actually is one of the first that I've come across that actually speaks to that. Another, not intended to shock you, but just a visual a display of all the competencies that we're expected to include or develop in our students, or expect our graduates to have, exhibit, behave. This is, I want to acknowledge a master's student of mine. She embarked on a mammoth task to look at all the published competency frameworks in physiotherapy, and there were many. And she literally synthesized and collated all the competencies, made sense of them, and came up with this framework. The pink bit speaks specifically to physiotherapy practice. It's also the most dense section of this figure. But just to give you some idea of all the other competencies which speak to what we currently all grappling with, is how do we teach all these other competencies, or create opportunities for students to develop them. So why change our program? Physio is, and I'm quite proud to be part of this team. Our physiotherapy program at Stellenbosch is always viewed by our 7 other institutions that teach physiotherapy. We've always been considered sort of leaders in what we do. As I said, we're the only program that has already utilized problem-based learning already for the last 15 years. And our students always come back very positive, and we get good feedback from our employers of our graduates. But what's more alarming is, despite all of that, what's really worrying is that there's an increasing number of students that are not able to meet the minimum standards. We can no longer pat ourselves on the back with an excellent throughput rate, and yeah, given all the other things that are happening around us, we really realize that, it's time to rethink, because if we don't change things, nothing is going to change. So we embarked on a bit of an R&R, and that involved looking at the last 5 years of student feedback, program, lecturer, and module feedback, as well as engaging with current students, the clinicians, our clinical educators, stakeholders, and even our alumni. And really, to cut a long story short, at the end of all of that, we realized that what we teach is actually not so bad. Yes, there was 1 or 2 gaps, but it's more about how we teach that we need to look for different ways of doing. So then we decided to follow the design-based research approach to guide us in this whole process. A little bit about DBR for those of you who are unfamiliar with it. It is advocated in education because it helps. One, it embraces technology, something that I think requires more urgency in many of our programs. But secondly, it really encourages us to explore educational problems, but considering the real world context. So in collaboration with practitioners, and also by the design of the process, it allows us to come up with new what's the word I'm looking for new design principles. So that's just another view. Many of you will be familiar with the typical cycles of, think about things, designing things, doing things, and evaluating things. It's very similar. But again, the 3 fundamental principles speaks to the notion of looking at the complex problems with everybody, all stakeholders involved, using technologies, also and using them in more innovative ways to find solutions to these educational problems, implement, rethink, and critically analyze, tweak, and come up at the end of the day with a set of new design principles. So our journey began with a precedent analysis, which, as I said, was a reflection and engaging with multiple stakeholders. Not sure if you saw it on the first slide, but what also happened in 2019, our board published new minimum standards of training, and so we embarked on a content mapping exercise just to see where we need to focus in our new way of doing. We also did a lot of benchmarking, and this is again where I think we were fortunate. I actually serve on our board for physiopodiatry biokinetics, and I chair the education committee meeting. And one of our responsibilities is to review all the programs that are registered with the HPCSA. So I've actually been in the position to look at what all our other 7 universities are doing. And so I have a good sense of what people are thinking and what they're currently doing, and also what they are thinking of doing moving forward. Similarly, we've had also lots of visiting professors from all over the world, and they've kindly also offered sharing how things are done in their context. So a lot of benchmarking, and then of course we embarked on some research looking for what is the best way, what is sustainable, and what is evidence-informed in how we can enhance what we offer to our students. So to cut a long story short, that led to a redefining our vision and also our philosophy of teaching and learning. And once again, to cut a long story short, the whole purpose was to better the students' learning experience. And something that I maybe forgot to mention at the beginning, before our students can actually register as independent practitioners with the Health Professions Council, they have to do a year of community service. Now, community service was initiated many years ago as an attempt by government to service previously underserviced, or still, in my opinion, underserviced areas. But the difficulty with that is that means students are often alone. They don't have seniors, they don't have mentors, they don't have qualified or experienced staff, and that's because the doctor there is also a ComServe doctor. And then you've got these usually well-established nurses. But that is the only level of support they have out there. And also 4 years is not enough to help them with everything they need to know. So again, to think a little bit more widely, what is our mandate? And really, Alan Bleakley speaks a lot about this. It's getting students to the point where they're comfortable with not knowing. Let me explain. So this whole notion of becoming, accepting that I don't know everything is important, because it influences how you behave when you enter into a situation where you don't know anything about. Imagine a patient who's traveled 200 kilometers comes to you and with a diagnosis or with something that you've never seen of before. You cannot say to that person, sorry, come back tomorrow or next week when I know a little bit more and I can do something for you. I mean, that's not what we want to do. So this whole idea of not knowing what you don't know just doesn't fly. You need to know what you know, and you need to be able to recognize what I need to know, but don't yet know, so that I can at least do something safely and effectively for this person standing in front of me. So that means they've also got to be able to access credible information very quickly. And this is where the technologies, again, have a huge contributing factor to play. Our other big challenge with literature or research, evidence-informed practice, is much of this research is conducted in the North. If you look at the populations of these studies, they are people that are usually coming from well-resourced settings, and that makes it really difficult to take and follow treatment guidelines, published treatment guidelines in a South African context. So what that means is that our students need to learn how to make sense of that information. They have to be able to extract from that, adapt, apply. We want them to critically reflect on what they do. And similarly, the power in that alone, in generating new knowledge, is so important, and our students should be encouraged to be more proactive in disseminating this information. So really the attribute that we want to shift our focus to in our new curriculum is really developing that of the scholar. So what does that mean for us if we are to ensure student success? It means we need to stop lecturing so much and start to find times that we can spend more time engaging with our students, having discussions, critical discussions with our students, touching on difficult topics, understanding that it's more about the process and less about the product, think a little bit more andragogy, less pedagogy. Sounds a bit weird, but we have young adults in front of us, and we really need to look into adult learning theory a little bit more closely. And then, as I said, this is one of the biggest challenges, because it applies not just to our students, also applies to ourselves. We need to make ourselves significantly more digitally literate and fluent. So in the design, we had to make some principal decisions, and one is definitely remain competency focused with specific emphasis on professional identity formation. And by that we mean developing this critically conscious practitioner who's aware of the person in front of themselves, firstly, the person in front of them, the communities from which they come, but also the systems within which they work. And then, as I've spoken about, the evidence-informed practice, and then, of course, the notion around if we are going to develop or graduate change people capable of making a difference, it is about forming collaborations, networks, so they really, more than ever, have to learn to function in teams. The other initiative was to start introducing the students right from year one to the clinical platform. And this already, I can tell you, has had an enormous impact in students' understandings of the relevance of what we're doing in the classroom. And lastly, of course, the technology promotion. Then COVID hit. I'm talking very fast because I've got lots to say. Apologies. COVID hit us, and in my opinion, I was quite happy, unlike everybody else around me. And why? Because it forced our lecturers to upskill themselves in some basic technologies, which is where we are moving towards. And just to evidence that they really did well in this arena. Post-COVID, we really had to reflect on, but what did we do differently during COVID? And we used this future change framework to help us unpack the good and the bad and the ugly, and identify what did we like that we want to take forward in this new curriculum. This is us working together online on the Miro board. So what did that mean? It meant we really embraced the notion of blended learning, and we wanted to expand on that in our curriculum. And here I want to do some marketing for the Advanced Blended Learning course, because there's such misconception out there around blended learning. Why? Because it's not just a blend of online and face-to-face, or self-study and face-to-face. It's really very much focused on learning. It acknowledges learning theory, ways of learning. I'll explain that a little bit more in a second, as well as utilizes various modes of delivery. Big thing, once again, it values face-to-face. And the other big thing, of course, it utilizes technology to augment the learning that's taking place. I agree here with JP. I think Dinah Laurie Lard is an absolute guru. It was only when I started reading her work that I actually started beginning to understand what the hell learning is all about. And she describes these 6 ways of learning. For those in the room, I'm sure this is nothing new to you, but it really makes one think that, you know, how people learn, and from read, watch, listen, acquiring information, to going out and searching for your own information, in sort of safe spaces where nobody's going to criticize what you are doing and how you are doing it, practicing, and there, of course, feedback and how we do feedback. It's another hot topic. I don't think we all fully understand or are fully feedback literate. Another big topic currently being researched. And then obviously changing a way in which we assess, rather getting students to evidence by developing a product or an artifact or doing presentations, etc. We're also well aware of the benefits of discussion, and of course collaborating really helps students to make sense of information. And also a part of Diana Laurie-Lard's work is this conversational framework. It really provides a very nice theoretical framework on how best we can construct our learning activities so that we make space for all these various ways of learning. So, and if anybody doubts, I came across this systematic review of systematic reviews. And included in this was 57 systematic reviews across 44 journals. So it is, in my opinion, overly researched topic. If you still don't get that it's worthwhile, there's something wrong with you. But what was disappointing, only one review came from the South African context. And again, it just highlighted this is nothing new. Why are we so slow in the uptake of which there is ample evidence? I mean, the conclusion of this review, if you look at all of those words popping up on the screen, it's exactly all the things that we are aiming to achieve. So the second thing, given that we had some experience with PBL and despite all the challenges we had, we really valued what it offers, and that is the idea of getting students to think more deeply and more critically about what it is that they're learning. And so we wanted to really include PBL from year one into our program. And again, just to spend a little bit of time on that, it was originated in health sciences, and since then it has been utilized in more than 60 schools, of which our physio department is one. And I think the big thing that it offers is everything that Diana Lorillard talks about. It provides opportunities for students to utilize different ways of learning. It's individualized, but students make sense by revisiting what they already know. The method is explicit in getting students to think about what I already know, and then to reorganize and reconstruct their knowledge. This next two slides, very briefly. This is a framework published by Instruction Design Australia in 2020. It also highlights the benefits of PBL. You create problem scenarios or cases that are authentic and have meaning to students. It's personalized in that students also need to go out and search for their own information. It is a guided and scaffolded process. There's a case facilitator to make sure that the students do stay a little bit on track, don't inadvertently go down too deep into a rabbit hole. And then again, as I've already explained, it's non-linear. Students can search whatever it is that they're interested in reading up more about. So it has the potential for extension. You don't have to stick to the case outcomes. Students can learn more than what we actually intend for them to learn. So there's various ways in which one can do or implement PBL. We follow the Maastricht 7-jump process. This is the Australian model, but essentially, very briefly, we create a case scenario. Students get together in small groups. They unpack the problem, make sure they identify what the case is actually asking of me, and then they brainstorm. What do they know? They clarify terminology, and then, and this is the critical part, students don't leave that session until they formulated their own learning outcomes. Note learning outcomes, not outcomes for the case, learning out. What do I need to go and research so that I can come up with a better, more plausible solution to the case in front of me? Then they go out and do their homework, they come back and they share the information, and then as a group reach consensus on how they want to solve this case. And then depending, and this is where we're slightly different from this model, we expect students to produce a case document or develop an intervention protocol or present something, and the assessment really occurs in a co-running module, clinical. That's where they get to practice, and it happens simultaneously. So what the skills that they learn here, they get to practice in clinical, and obviously the final outcome of this is assessed also in the module, of course, but also in clinical practice. The learning theories that underpin it, I'm not going to spend too much time on that, but it's a range of and these are probably the most dominant theories that are utilized in problem-based learning. And although transformative learning is not necessarily often spoken about, but PBL, because of its critical reflection, it includes critical reflection. If you design your cases appropriately, it does provide those opportunities for these tipping moments needed for students to, change their worldviews, and in so doing also regulate their behaviors when they engage with people that are different from them. The problem, though, is it takes time for all of these things, and we got to the point where we realized it might be fine and well that we are teaching barest minimum, But if we're going to make more time for these things, we actually also need to rethink the content, what we are teaching. Typical challenges of PBL we've also experienced. This notion that our students, despite using technologies, don't really know how to use it for academic and professional purposes. If there's too much of the same thing, it starts to get boring and they fall into a recipe of thinking rather than specific to a problem, etc., etc. And there's also the notion that it's resource intensive. So again, we needed to look for a model, and we chose the 4CID model. And I'm not going to spend time on that. This is what it looks like. It's complex. I haven't got the time to explain it. But the benefit of this is that it is developed from complex learning theory. It too embraces a variety of learning theories, and depending on how you create your learning activities, with little bubbles in the middle, a really, really useful model to help us make sense of blended learning, problem-based learning, and ultimately, what does that look like across within a module, across modules, within a program. Benefits are well described in the literature, and although again initiated in the field of medicine, but it has since been utilized in many fields as well. Yes, we started so where are we now, actually, in terms of our own program renewal, is we, due to circumstance, were forced to implement rather prematurely. In hindsight, a little bit of a mistake, but we were left without the first 6 months of our program, and we thought we've got this, and as a team, and we are a pretty good team, been together, many of us, for quite a few years, and we thought we would be able to pull this off. But again, we made far too many assumptions, and not recognizing that it's more than just development on paper, but it's a people management process, and that despite all good intentions, and we weren't all on the same page regarding many aspects, and one of those was actually understanding social accountability. A project that was run by CHPE, Prof. Susan van Skalkwyk and Cecilia Jacobs, we were participants in that study, identified that while we recognize our mandate in graduating critical citizens, we weren't all on the same page in understanding what that meant, and similarly what pedagogies must we actually use in order to reach that objective. Similarly, we thought everyone was experiencing reflection. No. We thought everyone understood PBL, given that we do it. No. And similarly, again, and this is partly because of the pressure we were under to develop content for this new way of doing, people are starting to, we're designing now for year 2 and thinking about year 3, people are starting to panic about, are we not creating gaps somewhere? Because the program is not being explicitly plotted against 4 years. Marianne can also add to our challenges also at pub level in order to pass many of our initiatives. So yes, I think I've spoken enough. I'll leave you again with the last a reminder of the take-home messages. I'm not going to repeat it because I know I've spoken too much. Just want to say thank you once again for the opportunity. Welcome any questions.
Marianne, I just want to, before we get to questions, I just want to say thank you very, very much for all the food for thought stuff. I can't think of another word, sorry, that you gave us here this afternoon. I mean, I just wrote some notes for myself about the fact that a curriculum renewal or program renewal is reflection and research based. And I think it's so important to lose sight. It's so easy to lose sight of those two issues, and also, as you say, people don't have experience of reflection, and that's a question I want to ask you just now as well, and how to assist people in developing those skills for the benefit of their program renewal process. The emphasis you placed on change and that change won't happen if you don't make it happen. But then also that in that change there are agents, there are people, and it's not just managing the paperwork, it's managing the people in that process as well. And then also, the affordances of problem-based learning, which I think is something we lose sight of here often. So thank you for bringing that to our attention again. And now, so questions, comments?
Marianne, I was thinking as I was coming here, what question am I going to ask you? Because I think we've been coming along, a while with this program Renewal project. And I thought that maybe first of all, I wanted to say thank you so much for, going into the detail of the messiness. Because it isn't a stylized, linear, lovely thought out, stick to an action plan kind of project. It's not that at all. And I think that you've captured the dynamics and that messiness and the challenges that go along with that so well this afternoon. So if you would have to do this again, let's say we can turn the clock back to 2019, whenever you started, what would you do differently? Because I think that's often, what, the kinds of messages that I would like to carry into conversations when I sit down with the department talking about program renewal. Thank you.
Thanks, Marianne. Yes, I was a little bit nervous what kind of questions you were going to ask me. It was, Marianne, last 2 weeks that we've, as a department, made a call to take a break and just to slow down a little bit. And I'm really grateful it happened now and not after the second year of implementation, because then the consequences would have been significantly more. What would I have done differently if I turned back the clock? Firstly, to just say that we would have not done what we did if it wasn't for contextual issues. But had that not been the case, what would have been the preferred method is to really have gone full cycle. So it goes without saying that we have started with the end product in mind, and we've looked back. That's what the model advocates, or the DBR advocates, is then to look back and see how we're going to do it. And the assumption I made, which is why I thought we were ready for this implementation, is we are all experts. We've been teaching physiotherapy for so long. It's okay to implement, because it's how it unfolds will emerge as we do. And so to say, yes, I would have liked to have been a little bit further in terms of content on paper, but we would have had to start somewhere, with all of us not really knowing how this is going to pan out. Because the development of the content of it's easy to define module outcomes and even begin to think about assessment criteria. And we clear on our teaching and learning strategy. That's not going to change, and it's the same throughout. And similarly, our assessment strategies, obviously, more appropriate as the years unfold. But the challenge with this, it is so new, and we've got nobody that we can go to say, are we doing the right thing? And it's that uncertainty. And I think what we should have done is mapped out, if we're going to let go of something, what is it that we're going to let go of to create some spaces? So yes, I would have liked to have been a little bit further, because I think that would have gone a long way to help people feel a little bit more certain about letting go of certain things and being happy with let's see what emerges. Because what I'm doing while we're implementing, rolling out the new curriculum, is mapping the current content that's coming out of the cases that we're developing and mapping that against our existing content. Now for physio, it's fairly simplistic. In our old curriculum in year 1 and year 2, we covered all the basic evaluation and treatment techniques that students need. So we consider that core foundational content. And it's that bit that everybody's getting stuck on. So now they're already entering into year 3, but now we haven't covered everything we used to cover in year 1 and year 2, is what's really a massive barrier for people to even decide, what am I going to include now in my content for now? My argument is, it doesn't matter. Just, there's your scenario. What do you think is appropriate? Stop worrying about the past and teach them what they need to know for this scenario. And we'll map the content as we go along. And if we, at particular periods when we identify a gap, we will then manipulate or tweak, whatever is the correct word, a case, so that we make sure that that basic concept is going to be covered in that case. But that, my colleagues say to me, it's all fine and it's in my head, but they don't know what's going on in my head. And so, I'm beginning to understand now, and also trying to help them develop content, and beginning to understand that frustration of. So yes, I would have liked to have had a little bit more on paper before we actually started. And from an administrative load perspective, it would be really nice if had approved what we're doing and we could just go on and do. And evaluate and et cetera, et cetera. So definitely would advise anybody embarking on program renewal just to delay the implementation till there's definitely more leveling the playing field in terms of everybody's understandings, but also their skills. It's incredible the challenges that have popped up. I spoke about feedback. I have a colleague who's doing an MPhil with the Centre for Health Professions Education, and she's looking at feedback literacy in both students, and I'm joining her in part 2, where we look at lecturer feedback. And it is actually quite scary what people perceive as good feedback, or what feedback practice should look like. And the whole success of this 4CID model and problem-based learning is how we guide students, and by guide students, how we give feedback on what they say, what they do, how they behave, etc. And we need some serious capacity building in that. And the purpose of this project is actually to identify what these specific challenges are, so that we can actually develop some staff capacity interventions to bring us all up to speed in terms of, because as with any curriculum, it is about the people, to breathe life into that curriculum and to ensure that the curriculum is a success.
Thank you.
Marianne, I'm Adeline, and my context is quite different from yours. I'm at the Language Centre, but I'm reflecting on my last 10 years because I have to retire soon, and thinking about the changes I felt very strongly about. So my question is, what's the most important lesson that you've learned about how to communicate your vision for change? We know that many of our colleagues are resistant to change for all kinds of reasons. But how should we really, because it's a vision that you're sharing, and you help. I hear the same kind of frustration that I have, not change for the sake of change. Change that can really make a difference, but not everybody would fall for that. A lesson that you've learned about how to communicate that vision.
Well, I think, I haven't really got an answer for you because I'm grappling with what, a few things that I've learned though is again, trying to put your vision in some form of vision, a visual depiction of what it is that you ultimately try to do. The method I've been using in asking colleagues, and I do the same in my position on the board when I speak to other institutions, I plant these little seeds in the hope that they will trigger some thinking further down the line, is when you listen to their frustrations. Now with our PBL, a classic one, we don't reach the objective. Why? Because students come to the case unprepared. What do we mean by unprepared? They've forgotten everything that they learned in other modules and in year 1 and year 2 needed to actually deal with the case. And our cases only span over 2.5 days, for example. So quickly to come back to your question, I always ask them, well, you keep saying that, you're frustrated, but think back about your own teaching and where you've been teaching. What was your contribution in students not being prepared for this case? So on the take-home slide, right at the bottom there, I did write about reflective practitioner, and by that I meant not just in your professional practice, but as educators. We aren't, I hate to use the word forced, coerced, incentivized to be reflective on what we do and really the outcome of it. The pressures of doing research and publication and everything else sort of, when it comes to teaching on an undergraduate program, it's very much, I need to tick that box. Let me go in, do what I need to do, come out, and as long as students are passing, I'm happy. But they don't really think about the impact of that, and especially not beyond the outcome of that module, the results in that module. And the only way to do that is to consistently repeat yourself, ask questions, and challenge them when they share their frustrations around, but reflect on what we're doing, how you're doing it.
Marianne, I actually have one comment, I think, and then maybe a question. And the first one, it's just interesting when you shared your presentation, you said the goal is to get students to be comfortable with not knowing, so that uncertainty, but it seems as if the lecturers are not okay with not knowing and being in this uncertain position. So it just reminds me of the graduate attributes and the teaching learning assessment strategy, where we say this is what we want our students to be, the graduates of the futures, and what kind of lecturers do we need. So just that link. So it was just something that I picked up. But my actual question is, you said the conclusion that you made was it is not what we teach, but rather how we teach. What does how mean?
So it's again stepping away from the old way of doing. I mean, our previous curriculum, luckily physio is fairly practically oriented, so there is some flexibility in that. But if you go and look at any lecture, how does it start? Any session we have with our students, how does it start? With a lecture, a PowerPoint lecture. And the lecturer typically races through everything and says, okay, now we're going to practice. And if you're lucky, there's a demonstration. If you're not so lucky, then students just have to get together in their groups, do some stuff, and then, well, there's multiple ways in which staff members facilitate practical skills development. Been some really nice initiatives that we're also taking forward in the new curriculum, but that's typically what they do. And I forget your question.
So the question is just what does how mean? Because how quite often is interpreted as the tips and the tricks and the things that I do, and I don't think that's what you mean. You mean something deeper, something bigger. And I sometimes think that maybe how is understood differently. And what other words can we actually use? So I'm actually struggling for myself.
It's ways of doing. I don't know whether that's a better word. Change the way in which we do things. I mean, semantics. I know how important that is, because for different people there's different meanings attached to words. But yeah, I wanted to say something now. It'll come back to me. This is what age does to you. In the middle of a sentence, now you forget what you wanted to say, but it'll come back to me. Just one other hand, maybe just answer the question.
How do you get your lecturers or your team to think the same about the how?
That's just asking the same question in a different way. So I think that has been our biggest challenge. Where we've been semi-fortunate, I think, in our division, we've got multiple staff members who have embarked on further training and education and do the MPhil course. Do I want to say it out loud? Critique of the course is it's very theoretical and not enough put what you learn into practice. However, having said that, the projects that have emerged from what some of our colleagues are doing have been super helpful in recognizing that we need to think about what we do and how we do it. To come back to how do we get them on the same page, that it is okay to forget content. And there, what I've done is taken a couple of classic examples, things that we've taught, as in recently, and in fact are still being taught today, are not relevant anymore in clinical practice. And that begs the question, why are we still including that? And that's probably the most useful words in our conversations that help people to think about this fact. But, that is the current, and that's the other problem. Current evidence, it takes 18 years in medicine or health sciences for new knowledge to be actually implemented into practice. It boggles the mind sometimes, but it is what it is. And one of the reasons is it's so difficult for people to change. I think this is just our attempt to get people to embrace change and actually see the value of change and remaining relevant sooner rather than later, as we experience in our generation. I always start my teaching and learning journey, always said the reason why I joined academia, but besides that I was frustrated and thought there has to be more than what I was taught, focus was, and the first thing I said to myself, I will never teach the way I was taught. And it took me 15 years of teaching and upskilling my qualifications in the process, professional qualifications, to get to this point where I actually was ready to practice what I originally 15 years set out was going to be my goal for joining the university. So, yeah.
Thank you very much, Marianne. It's really beautiful to see how these things come together. So my question is related to that saying that I just said, how things come together. Because as I read what you've shared with us, is you play a very important role in the process. So in all this complex network of not just knowledge and colleagues, there's also the bigger picture with the board and the country and even the globe, showing all those connections. And everything kind of flows through you, it seems. And so you make sense of it. So I guess the question is how important it might be for having someone that is that can play your role, because not everyone can do that, in terms of how this thing is making sense to everybody.
Yeah, and then maybe just to acknowledge in particular two of my colleagues, one who has a foot in CHBE and other Ms. Thon Schmutz, and the person who shares her office, Dr. Alison Lupton-Smith, who's currently busy with this feedback project. I have allies. And that too is immensely useful to not be alone in this future vision and trying to get to this future vision. And I think the value of also having staff members recognizing they need or want to do MPhil or further training in education and learning is going a long way to get people on board. If people can provide me with additional recommendations, I'm all ears.
Questions or comments?
So you mentioned that it was implemented for 6 months, is that correct? The actual new curriculum?
It's a little bit more complicated than that. We did a partial implementation in year 1. So what that meant, so really originally the vision was to integrate all the content of different modules and actually develop new modules from scratch, because the model advocates for in-time information. So we couldn't have anatomy, physiology, physics, chemistry, and then all the various physio and all the other service modules content separately. We actually wanted to absorb it into our teaching, but unfortunately the system there is a stumbling block. Finance model doesn't allow for it. MBCHBs took a leap of faith and they've got 260 credit modules. How they manage, I actually don't know, especially within the system we have. So there were a lot of things that and I suppose this is part of the DBR process. So our approach, all of this, we've limited to physiotherapy specific content, but my engagement with colleagues, where that has been beneficial is we've got better alignment between what they teach and when they teach. So anatomy, physiology follows on what anatomy is taught. So there's already better integration in the basic health sciences. Little things like that. So, and also the other challenges, we share many of these modules with other colleagues, other disciplines in our faculty. So the partial implementation referred to all the changes we made in the service modules. We weren't yet ready to do the physio stuff. We already recognized early on, no. There's a significant amount of content that needs to be developed for this new way of doing. If it is going to be successful, you've got to develop interactive material, because otherwise how are we going to motivate the students to be self-directed from day one in year one? That takes time. So we got the permission to delay the implementation of that. So the whole first year was different, bar one of the modules, which was the physiotherapy module. But only in 2023 were we actually able to start with the physiotherapy module. So that's what I meant with the partial implementation for.
What your perceptions were of the students' experience.
Yeah. So
the
this
new
is where I
curriculum.
also wish that we were a little bit further into the trajectory. So as with any new module, we do sort of a mid-module evaluation, and that's currently being conducted as we speak. We're halfway through. We've completed 2 cases of the 4 cases in the first year, and having been involved, I've put myself in the position to be present in the room when the students do the reflective sessions as part of the module. It's been phenomenal. The students really struggled and they couldn't quite get it at case 1. By case 2, again, because of the quality of the supervision and lecturers who better understood the process, the experience was significantly better. And now by the 3rd case, the students are really loving it and they're valuing it. And we've got no problems with them preparing for the contact sessions. We've got lots of strategies in place to make sure that happens, such as diagnostic quizzes, and you can't do this if you don't complete, there's lots of strategies we use to facilitate the self-directedness. So far super, super positive. And as I said, the exposure on clinical, that is year 2. The second years rave about it, and the 3rd and the 4th year students are so jealous of what they've had, because they are convinced that their first time onto the clinical platform in year 3, when they're also expected to treat their own patients, would have been a lot better had they actually known where they would have been working. So, anecdotal as of yet, but hopefully we'll have more rigorous outcome or results to share soon.
To make the next question the last one. Anybody?
Well, actually, make your question on the reflection.
Okay, sure. I will stand here where I can see Marianne. Marianne, yes, I was wondering, you were talking about the experience with reflection, and you reflect with your lecturers, you as a team reflected as well. So how did you go about teaching them how to do it?
Well, I don't think we were so successful, because I don't think we formally embarked on teaching lecturers how to do reflection. So there are a few of us who actually teach reflection and how to do reflection in our program. And so those of us who experience, are familiar with the multiple models of reflection that are there that guide this whole process, for them it was easy. But it's for the others. The others just thought, and typically what students do who are novice reflectors, they will give you a long list of things that I learned. And it's really nice to see, but essentially it's a copy and paste of the module outcomes, but they don't go to the next level of really critically thinking about it. What does it mean for me? And what have I learned about this that I want to take forward? And that is, and it's this recognition that people aren't reflecting on what they're doing and why they are struggling to understand why what I'm doing is wrong. The students are then doing so well. They, class average is 75%. What more do you want? And it doesn't go beyond the immediate. And unfortunately, assessment and our assessment practices is not helping.
So that's the next step, is it?
Yeah. Yeah.
Thank you. Thank you very much. Nicoline, would you like to say the last words? Or a last word?
A last word.
Thank you, Corin. Thank you, Marianne. Thank you from my side. I really think you brought a lot of things together in your presentation today. So things that we all try and instill wherever we go. So things about change, things about graduate attributes, things about reflection, about blended learning. So all of those things came together for me here, curriculum. So I really think we have a recording. We must use this when we talk to lecturers. So I want to ask your permission, even if we can cut short pieces from your presentation this afternoon. So thank you very much. And I'm not sure whether your fellowship is done. It is. Okay, so maybe in a few years you can take up another one. Or some of your colleagues could take up one then.
I'm trying to encourage colleagues to utilize opportunity, because the one thing with this, I almost want to say on a monthly basis, we identify topics that we want to research. We spoke about reflection. It's incredible how much insight the students' reflections give into understanding our students. Just to give you an example, in our in year one, that we introduced in the module Becoming a Health Professional into this notion of professional identity formation and reflection and actually developing a portfolio of evidence and being involved in that module and actually reading students' reflections. So one of the first things they have to put into their portfolio is, who am I? And the second thing they have to do is write a letter to their future self. What is the kind of physiotherapist that you want to be or expect to be? And the idea is, this is a sort of the beginning of our thinking because one of the things we ultimately want to get to is look into programmatic assessment. And the portfolio of evidence is something that is a critical component of programmatic assessment. And then for students in their final year, towards the end of their undergraduate journey, to go back to that letter and compare, are you still there? Or have you become that physio that you dreamed of becoming in year one? Or have you changed? And what does that look like? So.
No, thank you so much for sharing all your experience and your wisdom with us today, and for coming through on this rainy day, coming through to Stellenbosch. And to each one of you, thank you very much for joining. And those who will watch it, you've missed a great opportunity. Thank you so much, and to Karen. Thank you, colleagues. Have a good afternoon.
Thank you.